Hello, my name is Dean Gwen, and this is my community nursing plan for my community, Hale, Michigan. Hale is a agricultural community surrounded by national forests. A lot of the residents live here because they enjoy the seclusion and outdoor recreation. It has a population of 3,893 people spread out over 93.2 square miles. The population density of 42 persons per square mile is less than half of the United States average. Hale, the community of Hale is spread out into two counties, Iosco County and Ogama County. The town center is actually located in Iosco County, but it is within a couple miles of the border of Ogama County. So a lot of the community spreads into Ogama County. The town itself is roughly 4 square miles. In doing the community assessment, I used visualization results and research results. The visualization uh, is pretty apparent that Hale is economically depressed. The housing is adequate. It definitely appears older, but is not in a terrible state of disrepair like a lot of other places. There are limited businesses and employment opportunities in Hale. There's a hardware store, 3 food places, 2 of which are pizza places. One is a Subway that's located in the gas station. There's only one grocery store, but there are 5 churches. There's a noted absence of the elderly when you're in town, except on Sundays when family and friends bring them into church services. Hale itself is very homogeneous. There's very little diversity in Hale. It's 97.5% Caucasian, and 97.4% of the population has English as its primary language. The gender ratio is pretty similar to what it is across the U.S. In Hale, it's 51.6% female and 48.4% male versus the United States average of 50.8% female and 49.5% male. Hale does have a pretty high poverty rate. It is 17.7% compared to the national average of 12.3%. One of the notable data sets regarding Hale is that Hale has a resident median age of 58 years old. That is pretty significant when compared to the United States as a whole, is only 35.5 years old. 53.5% of all Hale residents are over 55, and a third of them of all residents are over 65 years old. 14.9% of all Hale households are residents over 65 living alone. That is going to come up later. It's a pretty important statistic. The top causes of death and mortality rates, heart disease was 254.1, cancer 169.8, chronic lower respiratory disease 65.4, and diabetes 63.2, and unintentional injury 58.2. That's also going to be another significant statistic in this community plan, as all of these are higher than the state average in Michigan. In Hale, there's only 2 family practitioner offices in town, 1 chiropractor. There's nowhere in town to get dental, vision, mental health, urgent or emergent care, or health departments in Hale. There is 1 assisted living facility on the south end of town. It houses approximately 40 residents. The closest hospitals and urgent care centers are 30 miles away. We do not have any specialists in Hale. There are a very minimal select specialties that are located in the towns closest to us that are 30 miles away, and Tawa City and in West Branch. They're both over 30 miles away. Most residents will have to travel over an hour and 15 minutes down to Saginaw, Bay City, for most specialists. First responders, such as the law enforcement and EMS, are also headquartered 30 miles away, closer to where the hospitals are located. So for nursing diagnoses, I chose risk for inadequate social and physical support among the elderly Hale residents related to increased risk for delayed treatment of an unintentional injury due to lack of familial support. The reason I chose this is because there's definitely an outward migration of working age adults. A lot of them have left for better employment opportunities, which has left a large aging population living alone. Another statistics related to the elderly that also came into play with this project was 36 million elderly persons report falls each year in the U.S., and that results in 88 deaths per day. Unintentional injuries is the seventh leading cause of death among the elderly in the U.S. And another serious risk for the elderly, ones with cognition issues or dementia or some other cognitive impairment, when they elope, it often results in poor outcomes. Why is it important to Hale? Recently, on November 9th, an elderly woman who lived with her elderly spouse, she was his only caregiver as they lived alone in the home. He actually had pretty significant dementia, and family did not live close by. Come to find out, she also had dementia, but the family didn't know that it was as bad as it was. She went missing sometime on Sunday, November 9th in the evening, and they didn't even know she was missing until Tuesday, November 11th in the evening. Subsequently, search parties were formed, dogs were used, helicopters were used. They eventually found her body the next morning on Wednesday, November 12th, in a lake right near her house. Aside from the tragedy that resulted from her, her spouse went from Sunday to Tuesday with, no ability to feed himself, go to the bathroom, get a drink, any of those things. He was in pretty rough shape. So I devised a program called Elderly Check-In, and the premise of it is to have at least a minimum of one contact per day to an elderly family member. That contact can be either visiting them in person, which sometimes is not always possible because of the outward migration, and sometimes people are just busy. Working age adults tend to have children in this area, and time is pretty limited. So another contact method could be by phone or social media, such as Facebook Messenger, those types of applications for smartphones if the elderly person is able to use them. There's also audiovisual apps such as Zoom. If those things aren't possible either, part of the program is to get to know their neighbors. Have a neighbor also monitor for your elderly family member's safety and well-being on a daily basis, and have that person's contact information, and they have yours, so that way if they notice something out of the ordinary, they can report it to you. So the goals I had set aside for this program, goal number one, my short-term goal, was to create and distribute a community-wide program using community resources and advertise it through radio, website, and flyers to encourage the daily contact by family, friends, and neighbors so they can monitor the health and safety of the elderly. And that was to be completed by December 15th, 2021. My second goal was to survey family members of elderly Hale residents and obtain a 75% positive reporting that they contact elderly family members daily, either by phone, social media, by proxy, or in person by June 1st, 2022. Two of the resources that I chose that probably have the most impact in this area, I chose the Michigan Department of Health and Human Services out of Iosco County. Since I chose Iosco County because the town center is technically in Iosco County, not by much, but it is. They offer a variety of programs to protect, encourage independence, and advocate for frail and vulnerable adults. You can get food benefits, household repairs and modifications, help with energy bills, funeral costs, help with paying medical insurance, getting Medicaid, and they also assist in getting in-home help. The second resource that I chose was St. Pius Catholic Church. They have resources there. They actually have a program where they track some of their elderly church members if they become ill to the point that they can't make it to church. They keep track of those people and they will offer to bring them food and communion when they are not able to make it. So as a resource, they would have access to some of these elderly, vulnerable elderly adults that would otherwise would go unnoticed. So for partnerships, my first partner was Sarah Haynes. She's the Director of Professional Services at ProMedica Hospice. The reason I chose her is I have somewhat of a formal business relationship with her already, and I know that she has access to at-risk elderly persons and family members in the Hale area because she's actively running the hospice organization for ProMedica in that area. She frequently collaborates with physicians and other healthcare agencies. So if something were to come up and I need some access to something, she usually has pretty good access to other people and other agencies. The second partner that I chose was Liz Hugerheide. She's a master social worker for ProMedica Home Care. She is probably the biggest wealth of information available on community resources that I am personally aware of. She has a lot of experience in dealing with agencies in both Iosco and Ogama County. She's been doing this for over 25 years, and some of the things she's really good at is obtaining additional services through other government agencies like NEMSCA, DHHS, Adult Protective Services, and other charitable organizations like the Fish Store and St. Vincent's de Paul. She's found a lot of people assistance financially and for transportation, housing, medications, food, heating their homes, and even placement assistance for getting people placed who can no longer care for themselves in their home. So the interventions that I worked on, I developed a list of resources within 35 miles of Hale, Michigan. I developed a protocol for requesting a welfare check, designed a website for the elderly check-in program. I created an animated YouTube video describing the necessity of program and why it's important. There's a couple of scenarios in there that kind of illustrate why it's important to be making that contact at least once a day. I also created a threefold brochure advertisement that was distributed in high traffic areas in Hale, such as the grocery store, hardware store, uh, the churches in town. All of these resources can be accessed at the website listed on the screen here. All of these resources were done uh, to help the vulnerable elderly, but the targeted audience is really the family, friends, and neighbors of these elderly persons, because the elderly may not be capable of managing those things on their own, as far as the getting the resources and stuff like that. And a lot of these agencies will allow some sort of family assistance to try to get these people the services that they need. Another intervention that I worked on was developing a radio ad, and that had gone all the way through to this, all the way through creating a script. Unfortunately, our local radio DJ that was assisting me with that, due to his work schedule and stuff, he's not going to be able to have that completed. He didn't figure until right around Christmas. And then after that, he intends to air it. So fingers crossed that that comes to fruition as well. So to evaluate the goals, goal number one was mostly met. The material has been created. The videos available, the website's available online, the brochures are available and in the community as of December 10th. The exception is the radio ad is not on the air yet at this point. Goal number two was my long-term goal. That one is not met yet, just because of the time frame that we're working on. But prior to June 1st, 2022, the intention is to have a poll conducted to see if family members are participating and contacting their elderly family members daily. And looking back, the goal was at least 75% by June 1st to report that they are doing so. So hopefully with continued push through advertisement and community outreach, that goal will be met. So in conclusion, Hale has a significantly aging population, and a pretty sizable portion of them live alone. And the elderly residents in our area have an inadequate familial support system. A lot of the family has moved away for work and other different reasons, such as higher education. In any event, they're just not available on a day-to-day or for 24-hour monitoring. So we created the program Elderly Check-In to encourage at least one contact daily. And the overall goal is to prevent delayed discovery of unintentional injury and reduce risk of catastrophic consequences to the vulnerable elderly. When a elderly person has a fall, a lot of times they fracture a hip or some other significant injury, and they have found that in injuries like that, delayed treatment tends to have a very significant impact on recovery times, if they recover at all. And elopement, if not discovered right away, usually has an extremely poor outcome. So these are the things that we want to prevent, and hopefully, these things don't happen in the future like they did in the past month. These are the references that were used in creating this PowerPoint.